Okay, this is an x-ray of a horse's head, taken of its nasal cavity from just below its eye. It came in with a one-sided bloody mucoid nasal discharge. So we put the scope camera up there, couldn't see anything, took an x-ray of it, and you'll see from these arrows that are just about to come into play now that the horse has quite a large mass in there. We weren't sure exactly what it was, but we had a reasonable idea that it was going to be either a maxillary sinus cyst or an ethmoid hematoma, which are pathologically similar conditions which respond quite well to surgery. So having made that diagnosis, the horse went to surgery, which is what you're about to see now. Okay, so this is the start of the surgery. This horse is moderately sedated and it's got some local anaesthetic in. We're making our incision, and we make the incision through the skin down onto the bone. There's a little bit of muscle there as well, and basically underneath this bone there's a big air-filled cavity, which is where the soft tissue mass, which in this case is an ethmoid hematoma, is situated. So we're just making that skin incision there. I'm just being careful there. You might be able to see there's a superficial blood vessel running across the top of the flap. And if you cut through that, it's always there. If you cut through that, they just bleed everywhere. It's not a big drama, but it makes the surgery a bit irritating. So now we're getting out our chisel. We're going to hammer that, and we are just, the bone here is only maybe less than 2 millimeters thick. And the horse can't feel, they just moved there just because it makes a bit of a noise whenever you start hammering. But he can't feel, these all local anaesthetic. You can see he doesn't mind that in the slightest. And we hammer away. We just basically follow the line of our skin incision, maybe make it a little bit smaller so that whenever we put it all back together, it all isn't in a line. So there's the bone flap there, you can see I'm just cleaning it out. And there's the inside of the cystic lining there that's all starting to fall out. And you can see you can put your hand right inside a horse's head. It's nearly all air down there. We have sinuses as well, but they're much smaller than a horse's. They probably hold 100 or 150 mils each side. So I'm just taking out the line in there, and you can see out this stuff comes. It's got a bit of a cystic lining and it fills up with, in this case, sort of mucoid type tissue. So we just pull that out. Sometimes you get blood out, sometimes you get very clear honey-like fluid. In this case it was mucoid type of tissue. And it all comes. But the important thing is to get out the lining of it. So they have a sort of cystic lining, so you can see now I'm just trying to get in round underneath that lining. It's a bit like an egg whenever you crack open an egg. So if the egg shell was like the horse's bone, then there's a sort of white lining in underneath that before you actually get into the egg. It's exactly the same here. There's a sort of lining which you can see just starting to come out now, which is just attached, not particularly firmly, to the inside of the bones of the horse's head. And if we get that lining out, because that's what produces the fluid that then can't go anywhere, but that produces the swelling in the horse's head. So you can see we've taken out, that's not all of it, but it's probably, I don't know, a third of it maybe. So there it is, that's the secretory lining. And it might have been in there for years. They're quite slow growing things. And then you might be saying, why in God's name would you do that in a horse that's awake? And whenever they're down, basically because their head's level with their heart, whenever you start doing the surgery, they start pumping out blood absolutely in the gallons. So I know that looks like quite a lot of blood, but horses have 50 litres of it, and that's probably only a litre there. Probably this horse altogether maybe lost 2 litres in the entire surgery. If we'd done that surgery down, it might have lost 15 litres. We might have needed to give it a transfusion. So that's us putting it all back together in there now, and then stitching it up. We stitch it up in a couple of layers. The bone just sort of sits in place. Usually it sort of interdigitates and stays in place. And we sew up the underlying subcutaneous tissue and muscle. We sew that up. Like so. And then we sew up the skin as a secondary layer. And we try and make all the sutures endodermal, so there's no sutures on the outside. We end up with hopefully a beautiful job like that. And the horses get over it really quickly. They just go back to the box, they wake up, we feed them 2 hours later, everything's good. And then we bandage it up. They're just like us. If you get hit in the head, your head swells up very quickly. So what we do is we bandage it up with this sort of what we call a World War One bandage. It's sort of the bandage that you tend to see in war movies whenever the World War One heroes get blown up. It's very simple. It only stays on for 24 hours and then the horse goes home. Some antibiotics, a little bit of bute, and hopefully never looks back.